Spectrum on Radio 1 FM90.
Brought to you by Finance Trust Bank, putting women first, and Mama Laundry Powder. Wash cleaner than clean.
Spectrum wants to hear your views. You can SMS at any time during the show. Type Spectrum, leave a space, type in your contribution and name, then send it to 7197. Your views, our interviews on Spectrum, Radio 1 FM90.
How are you doing? My name is Dennis Odwe.
Good evening, listeners. You're tuned to Spectrum on Radio 1 FM90. My name is Simon Kagwanjala, and tonight we'll be making sense of the country's health sector in view of the raging debate on how much has been allocated to the health budget in the forthcoming budget. And of course, looking at the general sector, how it's performing, how it's faring, plus of course, the debate on brain drain that seems to be, of course, making a lot of headlines in the country. And my guest tonight will be Mr. Dennis Odwe, the Executive Director, Action Group for Health, Human Rights, and HIV/AIDS in Uganda. Thank you for joining us.
Thank you very much. Good evening, listeners.
I'm also joined by Dr. Ekwaru Obuku, the Publicity Secretary of the Uganda Medical Association. Thank you for joining us.
Thank you too. Good evening, listeners.
Also in the studio is Mr. Godbatu Mushabe, an Associate Director at the Great Lakes Institute for Strategic Studies. Good to have you in the studio.
Thank you, Simon. Good evening, listeners.
I'll take my first question straight to you, Dennis. Could you give us an outlook of the health sector at the moment? Give us a picture of how it looks like in your analysis.
Yeah, thank you very much, my brother, and everyone listening there. When you look at the health sector, the journey for the last 10 years, I could say, the health sector has been limping. It has been limping. And government of Uganda has tried to see that we address some of the challenges in the health sector. For example, right now, the issue of immunization, there's good coverage there. Actually, 93% of children are immunized against measles. That's a good progress. We have seen government of Uganda, together with the private people, give us access to health facilities in the country. Actually, right now, as I speak, the number of regional referral hospitals are 14, whereas the general hospitals are 139, which shows that the coverage of hospitals is at its best. And that's why you find that government has put a lot of emphasis on infrastructure development. But when we look at inside those hospitals, there is a lot wanting. In terms of human resource, there is a huge shortfall. Like you'll hear from my brother Buku, who will tell you how many health workers are leaving the country each and every day. In terms of access to a doctor, one doctor is serving over 10,000 patients, which is far much against the WHO recommendations. When we come to issues of medicines, yes, we have seen government struggle very, very much to ensure that there is access to essential medicines, especially at level 2 and level 3 of care, where they push medicines according to the procurement plan organized by the health facility in charges. And this, we have seen access to medicines in terms of its availability shoot up to 70%. So there is a shortfall of 30%. And you know what it means when we say there is a 30% shortfall with a population of 35 million Ugandans. You get to know that there is a stock out of medicine, because that 30% which is not covered by government means that the pregnant mothers, the children who are sick, the elderly persons who are sick cannot access that 30%. And that's why you find that in terms of out-of-pocket spending, the households have to dig out of their pocket 30% in order to increase access to medicine.
So generally, before you proceed, would you say that the country is making more gains than losses, or it's a gloomy picture?
When you look at the budget outcomes that the government commits itself annually, 1, in terms of increased delivery, 2, in terms of children under 1 year protected against life-threatening diseases, and 3, health facilities receiving adequate stock of medicines, I can say government is at 45% in achieving these targets.
Godba, you're very good at statistics and all these percentages. What impression do you get from the indicators that Dennis has highlighted?
Now, I basically I would say that I basically agree with Dennis that at the macro level, it's very easy to actually say, oh, there has been a lot of progress. But when you dig deep into the data and the statistics, and you go to the micro level, which matters more to the ordinary Ugandans across this country, you really see very dismal performance. And you realize that the government of Uganda, I think over the last 10 to 15 years, has tended to emphasize more on infrastructure. So even in the health sector, the biggest investment has gone into building health centers across the country. Now, I've just been involved in a piece of work, doing field work on for some work we've been doing on public expenditure governance in the health sector. You really get overwhelmed when you go across this country, because I think the work that we've been doing, we went to Luwelo, we went to Gulu, we went to Rukunjiri, and I think Kamuli. You get overwhelmed when you see a network of health services infrastructure in terms of buildings that are basically malfunctional. You know, health center 2s, health center 3s, health center 4s that are overwhelmed with big numbers, staffing at around 50-55% staffing levels, reports of drug stockouts. So I, in other words, it's very easy for us to say maternal mortality has gone down, infant mortality has gone down, life expectancy has gone up, because those are the statistics.
Rhetorical statistics?
Yeah, but no, I don't know what measures actually how they generate this data and aggregate it. But then when you meet women who cannot get appropriate health care, when you meet children who have not been attended to because in these health centers, because in all these cases we meet people from from the village health teams. They tell you, some of the families tell you, we were at this health center for a whole day and we couldn't get attended to. So then you begin to question the relationship between the statistics that we are given and the reality that you meet when you get to these health centers. So I think that I guess my own characterization of the problem is that we have investments in health, but as government, we have failed to create a system that works, because most of these things work as systems. So a system comprises of different components, and they work together in unison to deliver a product. So in our case, in the case of healthcare and many other sectors, by the way, it is not only the health sector, there are no systems. In fact, that's why you find that we say, drug stockouts. Instead of making the health system work, the immediate response is create something in State House to do drug monitoring. Mm-hmm. Then you say, we have many Ugandans who cannot get proper diagnosis and treatment from here. So you can't make the system respond. The immediate response is spend money sending these people abroad. So you have a system breakdown within this system, you could find a few things working here and there, but the system is just
Accidentally?
most of them probably by accident or by some individuals within the system who think they want to make something work. But you know, unless you have the system working, unless you create this as a system, you are not able to deliver the product that you want.
Dr. Kwaru, you're right in the middle of all this. Is it as messy or as glossy as it's been painted?
Well, thank you very much once again for inviting the Uganda Medical Association to deliberate on this very important issue of health. You know, health is wealth, and a healthy population will achieve our aspiration to go into a middle-income country, which President Museveni has always aspired to do, and he spent 30 years trying to take us there. Well, I must start by saying that Uganda is a fragile state, meaning that the government does not have the capacity to meet the needs of its population. And this is a critical juncture that we are discussing this budget. Why? Because we are at the point where the world is now assessing itself and saying, how far have we gone in terms of achieving the Millennium Development Goals? And specifically here, of course, related to health, isn't it?
Right.
And what is our scorecard? Maybe Godba has the statistics. You said is a statistician of sorts, isn't it? I'm aware of only one statistic where Uganda has performed well, and this is in terms of reducing the burden of tuberculosis.
That's on the health front.
On the health front, isn't it? On the others, I'm really not too sure. And I'm actually surprised that Mr. Odwe here is talking about improvement immunization when not so far ago, we were lacking vaccines, BCG was stocked out, etc., etc. So his statistic needs to be queried. But speaking from the point of view of the Uganda Medical Association, I'd like to say that we represent the interests of doctors. We recognize that quality health care and increased access to health care should be accrued to the public, isn't it? That is really our utmost reason for existing as doctors. It's a calling. But at the same time, we are saying, what is the contribution of the doctors? What is the contribution of the health workers? Where are they in this mix of trying to improve infrastructure?
Because you are the center of blame. Everyone is saying it's because blame it on the doctors.
No, I don't.
They are always absent.
Simon, I don't think you are right, because I don't think that the public sees doctors as the problem. The public sees more of government as the problem. Either the government is too absent or is too present. Because you see, the government is the one which makes sure that if the doctors who have been assigned duties are supposed to do them. If the doctors do not, my immediate question is going to go to government. Why do I go to a health center and there is no doctor? Of course, the doctors have their own ethical responsibilities according to their profession.
Exactly.
But at the end of the day, if I go to a public health center, there is supposed to be a system that makes sure that there is a medical worker.
Let me finish.
How are doctors interpreting this kind of
situation?
malaise? Yes.
I must tell you a few facts. As we speak today, intern doctors are the new doctors, those who have just left medical school. And I can guarantee you that is the hardest time of your life. You work literally 24 hours throughout weekends, etc., so that you can graduate from there and probably go and manage cases in a health center for etc. They have not been paid for over 4.5 months. They have responsibilities. Some have families. They have to feed. They have to clothe themselves. You know what I mean? So tell me how you and me can go to work without pay for 4.5 months. And then, at the same time, you are seeing money being dished in non-priority areas. I think government should take this opportunity to rethink its strategy. It's not enough to say there is no money, because we are seeing money elsewhere. You get the point?
Dennis, as a civil society activist, we normally call you activists, could this mean that perhaps your activism has failed to the extent that interns go without payment for 4 months and no one is raising hell over this?
No, I think activism is a continuous process. I cannot say that we have failed. We have made several milestones, and I believe the journey is still continuing. When you hear health workers striking and going to meet the Minister of Health in the Ministry of Health headquarters, it tells you that activism is taking place. It shows to you that people are getting to know that they have their entitlements that must be met by the government. If you hear that intern doctors in Murago are laying down their tools, it's a sign that people are listening and people are watching. But health workers may not fully lay down their tools because of the professional ethics and code of practice that guides them. They're supposed to be compassionate, and they are not supposed to leave a human being die.
And they can go hungry for 4 months.
That is the training they go through.
You know, I must tell you one thing. First, I'm a member of the family.
Yeah.
First, I'm a human being.
Yes.
First, I'm a Ugandan.
Yes.
I also need treatment. I feel pain.
But you're
I
bound
use
by your
fuel.
professional ethics.
Indeed. But whereas that is a calling, must I do it when I'm starving?
Actually, Dennis, I'm surprised, Dennis, you say what you are saying, because my profession, my practice has been in civil society. I'm a lawyer by training, but I've done over 18 years of my career in civil society. And I think that for Dennis and I, we need to appreciate our failures in trying to get government to behave as government. Because right now, our government doesn't behave like a government that is supposed to take care of the people, that is supposed to take care of doctors. And every time for us, for people in civil society, they keep on saying we are making progress. Sometimes I find a lot of disingenuity in our statement that we are making progress, because you see, we are saying, oh, we've made progress. Intern doctors are striking. The hospitals, all these health centers you've seen across the country, they don't have functioning. First of all, they don't have ambulances. Those that have ambulances are not functioning. But you know, probably less than a month or 2 months ago, the president was handing over vehicles to district caddies. Almost every district caddy gets a vehicle. A government that is not able to provide a functioning ambulance system to its health system, because I talked about the system. A health system that works, it means that you have an ambulance system that works. So as government, you are incapable of making that part of the system work. And then you say, we don't have money. You can't pay your health workers. But I think the president went to Kanungu the other day and donated 150 million. 100 million shillings cash. Man, this is a church. In church, Christians contribute money. We go there in church. In my church, I contribute money. I don't expect the government to be spending Ugandan taxpayers' money to build churches when health workers cannot be paid.
Why, in your opinion, do you think that health has been given less priority?
No, it's not only health. Simon, you get it wrong. It's not health. It's also agriculture, where we spend about on between 3 to 4% of the budget, and yet we all these government officials keep on telling you agriculture is the engine of the economy. Over close to 70% of the population is employed in agriculture. You know, all those silly statements that they make. You go to education. You imagine a government that cannot provide lunch for young kids who go to school, and you go and donate 500 million shillings to the church. Come on. We basically have, I think as Doctor said, we basically have our priorities upside down. Period.
Would this qualify the typical statement that Uganda's health sector is sick. Over to you, Doctor.
Actually, I must say the Uganda health sector is on drip.
We'll take a break at this moment, and when we return, we'll be looking at how much is going to be allotted to the health sector in the forthcoming budget and how significant it will be in curing the problem. You're tuned to Spectrum. Good evening.
They call it brunch. Some come for the Spanish omelets and steaky bacon. Others choose it for the mouth-watering pastries and Belgian pancakes, or the steak, or just the sheer joy of spending a lazy Sunday afternoon enjoying great company and delicious food. Whatever your reason, come to Sheraton Sunday Brunch at 7 Seas Restaurant from 12 p.m. to 4 p.m. and bring the kids too. They can enjoy lots of free activities, including a soak in the pool, 65,000 shillings for adults, 35,000 shillings for children below 12, and free for kids under 4 years of age. Well worth it. See you at the Sheraton Kampala Hotel.
Oh, the talk you'll have.
Hello, Daddy. Good night, Daddy.
The good night call. Talk as long as you want for as little as 19 shillings per minute from midnight to 5 a.m. every night with Night Zone from MTN. Dial star 135 hash now to register.
Welcome to the new world.
MTN. Everywhere you go.
Refreshments on Spectrum, served by the Kampala Sheraton Hotel. Celebrate your romance with an intimate buffet at Sheraton Kampala Hotel.
Spectrum on Radio 1 FM 90.
Well, we're back and you're still tuned to Spectrum on Radio 1 FM 90. We're still looking at the state of Uganda's health sector. In light of the forthcoming budget, this year, 2014 to 2015, rather 2015-2016, close to 1 trillion, that's about 999.45 billion shillings, will be allotted to the health sector out of 18.3 trillion shillings. How significant is this amount? I'll begin with Mr. Dennis Odwe. What do you think of this amount?
Mathematically, when you're talking, I want to give this analogy from a home perspective. When you're supposed to cater for school fees of your children, you're supposed to feed the children, you're supposed to dress them, you're supposed to meet your transport needs, this kind of allocation cannot meet the budget needs, let's say, for a family. So when I get into the health sector perspective, when you look at the budget outcomes of increased deliveries, ensuring that children under 1 year do not die,
those are the targets.
Those are the targets. When you ensure that there is adequate stock of essential medicines and supplies, this is not going to achieve anything. We are going to have extremely a big problem. For me, I want to tell you, how can a budget fall by 4% when you're moving into election year? How? When you are implementing the National Development Plan, you're implementing the National Health Sector Strategic Investment Plan, where we should be moving progressively, not regressively. It shows to you that the 6.8% share that the health sector is getting from the 18 trillion budget is not going into service delivery.
In other words, do you feel how much would be in your thinking, how much should be allocated towards the health sector?
Actually, by now, we should be having 15%. I would like to tell you that even right now as we speak, this financial year 2014-2015, government is only allocating the per capita investment, that is per person investment, on it's only 33,600 shillings. That is per person. Then, in terms of medicine, they're only allocating $2.4. And when you translate it in Uganda shillings, is 6,000 shillings. And can I tell you what?
Per
person. 6,000 per person on medicine.
Per year?
Per year. So, in terms of that, What does it mean in provision of quality health care?
Could you break down 6,000 for the listeners?
Six-
out there?
six- 6,000 is
does it buy
one and a
Panadol?
half loaves of bread.
The big one.
Yeah, because the bread is about 3,000 or 4,000 shillings.
It's
I think.
4,000 as per the
4,000
current
shillings.
prices in
Exactly.
our supermarkets.
So you talk of like 1.5 loaves of bread.
Yeah, but are you mindful of the fact, Godby, that government is hard pressed on issues like security, national security is very paramount?
I can tell you, Simon, that Ugandans, we have been taken for a ride. Because if the problem was security, you would not have 92 billion shillings for a president to give away in pledges and gifts. Never. Because you have government agencies and ministries that are supposed to be doing the work of delivering public services.
Right.
So you don't need to have a president who has to run around carrying envelopes all over the place, and therefore he needs 92 billion shillings. So if it was security, then that is an area where you could easily cut money and put it to police and intelligence and the military. I think that right now, the biggest obstacle to this country moving forward is this whole question of big government. Big government right now is standing in the way of progress. Because if you consider the fact that you have a huge executive, 78 ministers, and over 100 presidential advisors. Remember that presidential advisors are at level of cabinet minister. So in other words, if you have some, that number is always never clear on presidential advisors. They could be around 150 plus 78. So you're talking about 200 ministers running a small economy like Uganda, which is really like the maybe a monthly income of a big corporation.
Right.
You have a parliament of 385 MPs. Now you can see the harabaru around creating new constituencies because of this election. So we are going to have over 400 MPs. So in other words, you cannot recruit and pay doctors, but you can afford to have an additional MP. I think that we, as a country, we are really being taken by for a ride, and then we are told, oh, you see, we are really hard pressed because we don't have money. And then you can look at the entire administration infrastructure across this country, and I think that
Dennis, there is what we say: half a loaf. That adage of half a loaf is better than nothing.
No.
As a member of the Uganda Medical Association, as a practitioner, how best do you feel this money, little as it is, can be utilized?
Yes, thank you once again. I wanted to pick on from Godby's example of ambulances versus the vehicles being given out. Even if you are to, facilitate ambulances throughout the place, at the city, at the districts, who is going to be waiting there, the casualty?
Yes, yeah.
For those ambulances to bring in
the
work,
casualties, yeah.
to bring in our patients, to bring in our citizens, to bring in Museveni's voters, by the way. Health is a vote winner, and any politician knows this. And this time of elections is when to even commit more money
that's right.
in health to show that it is your people who matter. They should be healthy after all to go and vote. But who is waiting for them there anyway? It is doctors. Now, tell me, that intern doctor has worked throughout the night.
Yeah.
He knows that for 4.5 months I have not seen any pay. There are demands from the village. Someone is calling you, please, can you send money? Can you send help? And you're telling me the ambulances are fine. They have come. Just answer. Think about that.
Now,
I think, Doctor, the point that I was trying to make is that, and I think I made this earlier, that you for each of these sectors, you need to have a system that works. So I was giving ambulances as one example of part of the system that is malfunctional.
Exactly.
But
Dr. Buku,
Yes.
the budget is almost out.
Exactly.
Health is getting 999 point something billion. How best can it be utilized?
Now, the figure it looks fantastic. But the question I want to ask is, first of all, how much will actually be realized How much will reach the Ministry of Health? See, that's the other question. It's one thing to budget 1 trillion, and it's another for that 1 trillion to actually reach and reach in time.
The budget.
So you already have your misgivings even before the money comes.
Before the money comes. Secondly, where is it being allocated?
And where should it be allocated?
And where is it being allocated currently? Fine. The situation of availability of drugs has improved, isn't it? Infrastructure, when you go to Mulago today, it's a construction site. And many other places.
It's tremendous, isn't
and
it?
thanks to government.
What are you saying? It's tremendous.
But at the same time, who is the greatest infrastructure in any company which succeeds? Who is the greatest infrastructure?
The human resource.
Where we need knowledge is a knowledge-based industry. This is not a factory where you produce, manufactured goods.
No.
Here, doctors and nurses are applying brains.
They are the biggest.
So that is
input.
where you should apply your money. If I'm not paid, even if aspirin is there and chloroquine, who is going to inject it?
Who is
Get what
going
I
to
mean? Who
prescribe?
is going to operate the mother? If I've just operated 10, I've just gone to sleep and you haven't paid me. I'm also a human being.
Yeah, but even
So
with
the
the
money-
little,
the money should
you
be-
take home,
you know-
Yes.
you know some-
doctors are accused of being absent.
you know,
Let me tell you
Simon,
one thing.
Just a second, good.
Intern doctors have taken home nothing for 4.5 months. So there is no little to talk about. There is nothing. They have to do other activities to ensure some money is coming. Because when you leave medical school, your parents says,
You're not.
society
I have
says
a
now,
doctor in the
can you
family."
start paying back? Musao, expectations are high. You want to drive. Musao in society is supposed to be, up there. And here you are, seated, okay, trying to make a living, trying to do your passion. That is to save lives. This is what we are trying to do for 5-6 years.
Are doctors still passionate about their job?
Very, very passionate. Go and look at intern doctors in Mulago who are doing their work without pay for 4.5 months. Go to Jinja today. Go to Arua, where I was for my internship. I didn't go to Arua because I have relatives there. I said, why don't I go to the farthest corner and serve humanity? I went all those camps, all those refugee camps. Those who are Sudanese, they were not Ugandans, they were not my relatives. It's just passion that we do this work.
Dennis, you're part of civil society. When you look at this allocation, this provision, anyone would get an impression that maybe it's been devoid of civil society engagement. That's why maybe government in its wisdom has come out with this little amount and given it to the health sector. Where is civil society in this?
In terms of allocation?
Yeah, at least maybe you could have advocated for something a little more.
Yeah, one thing I would like to mention here is that the consultative process has been very minimal. And that is because the inputs of civil society could not be included in the reviewing of these framework papers.
So do they look at you as inconsequential?
No, that's not. But of course, you know, as a matter of fact...
Dennis, let me tell you something. Just accept as being inconsequential. There is no crime in that. You just accept. You see, I am a student of public policy. For the last 18 years, ever since I finished school, I've been concerned purely on public policy making. So when you study the politics of policy making in this country, there are two important points that you need to take into account. One is that the locus of policy making has been shifting. Right now, the major policy decisions are taken either in State House or in the movement caucus. Now, I can tell you that civil society has no experience working in those areas. You don't know how to influence State House. You don't know how to influence the movement caucus. Because for us, we are used to working with the Minister of Health.
Exactly.
That's what we do, because traditionally those are the agencies that are supposed to make policy. But all of a sudden, you see that shift.
So Dennis,
yeah, I do concur with you.
Do you feel you're still relevant in the promotion of health services in the country?
Yes, we are very relevant because we play big role
can't bite.
in
Simple.
influencing policy. No. Look, in financial year 2013, 2012, 2013, we engaged with the government together with the citizens of this country, and they allocated 45.9 billion towards recruitment of the 10,000 health workers.
Yeah, but
So
that was
an
again
achievement.
dismal
Were the
compared to the
10,000 health
challenges.
workers
But
recruited?
they only recruited 7,000. And that is why up to now there's still a deficit of 3,000, which is yet to be recruited. I don't know whether they will do that as per
Was
the
the
budget.
7,000
framework.
actually
Dr. Vokus
Although-
seems to disagree with
Yes, no, I am actually trying to build on his point. As I said earlier, Uganda is a fragile state. So government should recognize that there are other players in this mix. There are the so-called non-state actors who actually fund a significant proportion of the healthcare expenditure. They provide the services, okay, beyond the government. And they should engage these people in the budgeting process. The budgeting process should be shared. There is no reason why the health workers, representatives of the health workers, professional associations, should not be involved in the budget.
Do you want to say that government could be speaking with a lot of deceit when they come out to post that maybe Uganda's health sector is making steady progress?
Well, that is a detail I wouldn't want to go into and specify that, government is deceiving here and
You
there. But
still
it's
need
obvious.
your job.
Well, I'm a researcher and a student. I'm a PhD student. I've never, much as I've wanted to work for the government, I've literally failed all interviews to become a doctor. You know what I mean? I have sat interviews of the public service and never been employed, yet I have the passion. But the other people who have employed me and found me useful. I teach doctors. Okay? But back to the point, I don't really want to deviate from the point that at the end of this all, government needs to sit squarely and understand that the human resource is the key to these problems.
Yeah, and when you look at the
To
health
solving
system,
these problems.
when you look at the health system the way it is, human resource is the first component of that system to work. You can bring medicine, you can have
I think
infrastructure,
it's every system.
but human resource is a key driver.
The biggest resource you have as a country is your human resource.
But apparently, there is also a debate on human resource that is moving abroad. That is going to work
By
abroad.
the way, let me tell you, for me, if I was in charge of this country, and we know there are doctors, there are countries that need doctors there,
You would export.
I would be putting money here in training Ugandan doctors and exporting them, because if there is a market, why not? So the problem that we're having is that you have a government that doesn't know how to plan, so they want to export the few doctors that they have. But we are here saying, there is massive unemployment. But if we had provided the resources we need to train.
But I want you to be precise on this.
Yeah.
You support brain drain.
It's not brain drain. It's really labor export.
Let me,
I would call
exactly.
it export of labor. You see, Mauritius transformed. Mauritius has transformed from a sugar economy in 1970 to a knowledge-based economy by 2010. After sugar, Mauritius's biggest export was labor. Train the best brains and export to Europe. And therefore, the moment you have enough critical mass, exporting excess labor is not a problem.
Yeah, specifically to health.
Yes.
As I speak today, there is a backlog of intern doctors, about 300, 400 of them, who have not even done internship for the past 1 year. They have been seated.
So how come they can't?
You want to say doctors are unemployed?
Can you imagine
Doctor,
that? No,
why are they not in these health centers that are
this issue
How
of planning.
how do you work when you're
this
not
issue
being
of planning
employed?
that Godba is talking about is very true. There is misplanning. I mean, you are saying there are no doctors, and here they are, 300 trainees seated there, waiting for places. So it's a good thing in a way, and we can take advantage of this. Because now
Give
more
us a
doctors
picture of
now-
how
so-
many doctors are exported abroad.
So, according to the Uganda Medical and Dental Practitioners Council's report, there were about 120 doctors who requested for certificates of good standing in the financial year 2013-2014, implying that about 120, 150, up to 200, because some don't report, who leave the country every year. But that wouldn't be a problem, because right now we are manufacturing doctors from Ishaka. Okay, from now Busitema is also a new school. There is a new one, international IU, and many others. So what we need to do is to be organized, work together, even with the private sector, and actually trained these doctors for Uganda, but also for export. Philippines did it. They were training nurses. There were schools specifically there to export nurses abroad. And the market is there, and we can make money out of it.
All right, let's take a few calls at this juncture. The numbers to call on Spectrum are 0312 260 390 and 0312 261 390. 0312 262 390, 0312 260 490, and 0414 348 111. What's your take? What's your assessment of Uganda's health, the state of Uganda's health sector? And you could also,
the doctor said it's in the ICU.
You could prescribe solutions to the problems. Spectrum, good evening.
Hello, good evening.
Yes, your name and where you're calling from.
My name is Sam.
Sorry?
And I'm moving. Yeah, I find that discussion interesting, but I first wanted to remind Godpa that you avoid using sweeping statements that government has poor planners. That's a big statement which you should not utter. Secondly, yes, it is true that we can have doctors trained. Actually, I'm surprised that there are 300 doctors who have not got internship. Even if those are there, they only Mulago Medical School and the Mulago Hospital should arrange a 2 shifts, morning and evening. They train all of them, push them through, and they are ready. And it's also true that if we don't even have to have enough manpower. If those are going to earn money, in their ambition to earn their own money, they will earn national money in terms of dollars. So let's train for our local market, and let's train for those who can. And if we have people who have not done in time, in my small way, I hope I'll talk to the Minister of Health, Dr. Ukwab. There must be a way to get them through the internship. The people should learn from Barunywa. 300 people can be put to internship between Mulago and the Bara University with the 2 shifts. Thank you.
All right, thank you. Sorry we never took your name, though. Good evening, Spectrum. Hello? You're live on Spectrum. Good evening. Oh, maybe you'd have to respond to the gentleman first. There seems to be some will to do some work. Maybe we'll take another caller.
Hello.
Spectrum, good evening. Hello.
Yes, good evening.
Your name and where you're calling from?
Yes, my name is Bob. From
Bob.
Mutinda. First, I go to the first caller who threatened Godba not to utter things that he considers inappropriate. If we, the citizens, think the government is not planning well, then it's our duty to say it. Secondly, I think the forthcoming budget is an election budget. And even the minister himself is the kind of person who can say anything as long as he's saying what pleases his master. You saw his performance when he was in internal affairs. He can say anything. So I expect that he will be relieved of his duties soon after elections. I thank you.
All right, thank you. We take just one more caller before we wind up on calls. Spectrum, good evening. Hello? Well, you would come in here good but first. You came under attack.
No. I actually don't call it an attack. I consider it as an opinion. My interest, the interesting thing is that everything he explained, I didn't pick the name of the caller, but everything he explained validated my point of lack of planning. Because you see, basically, if you have students, you have admitted students to the university to study medicine, to be doctors, then the idea that they are not able to get places for internship means that you don't plan.
Is it poor planning or poor implementation?
No, there's no such a thing as poor planning and then poor implementation. It's one and the same thing. So, and let me also put it this way, that I know, because I interact with many people in the public service. They are actually people who have a lot of will to do so many things. They want to work. They want the system to work. But I keep on actually telling them that the political context within which they are operating is the problem. The budget that we are dealing with is, the problem with the budget is not because of policy. It's not because of planning. It's because of the politics. So, in fact, until we fix the politics in this country, you cannot expect things to go the way they will be. We'll keep on, massaging and, circumventing problems here and there, and we look like we are making progress, but we'll not have the dramatic progress.
You sound honest about this. Is civil society part of the problem?
Oh, no. Right now, I actually think that civil society is part of the problem, because in civil society, Dennis, we are pretenders.
In what context?
We are project people.
We are project time.
We are project people. So we get funding. You go get funding from DFID, or you said, and your preoccupation is how to deliver on the outputs in your work plan and the log frame. And once you do it, you tick the boxes. We have succeeded.
But on many occasions, we align our projects to the government plans and strategies.
Yeah, but what are the government plans? Because if the government plan is to run a system that doesn't have a functioning ambulance system, do you align yourself with that plan? Because you see, the plan in the health sector, we had a plan to build health services, health centers. But how much did we focus on training and building the financial resources to be able to staff those health centers? Because you can plan to build health centers. If you cannot plan to have the resources to be able to staff them, then that's not a plan.
Dr. Buku, amidst all this mess, is there any urgent solution to the problem? Of course, putting into consideration that this is all there is.
This is all there is. There are quite a number of remedies, and research evidence has shown there are things which work and there are things which don't work.
Give us the practical
But
one.
first things first. Pay the engineers at Molago. These are the body engineers, the doctors. Pay them. Pay these young boys and girls. And they do the immediate.
Yeah, but the resource envelope is thin.
This is money.
Simon is being provocative.
I understand what he's saying. This is money. This is money, actually, that is there. I can guarantee you. It is money that is there. It is the commitment to pay them and to pay them in time that is lacking.
Could it be that you cannot push?
What do you mean by that?
As the association.
As the association, we are decent. As he told you, we don't necessarily want to go down there and lay down tools, because it's my sister, it's my brother out there who is going to die. For
neighbor.
What? You know what I mean? So we are continuing to engage.
From work, isn't this a silent strike of Sunday?
No. Actually, we have continued to engage the Ministry of Health. We have had long-standing meetings. All right? We've tried also to work with the, civil society. We are civil society ourselves. But I didn't want to go without mentioning this point. Government has been dilly-dallying with this issue of the national health insurance. For me, I think, and we think in the Uganda Medical Association, that this is the way to go. It is not enough to say there is not enough money. The resource envelope is little. After all, aren't these voters of Museveni paying for health care in one way or another? Why can't we have this health insurance scheme or another mechanism supplemented by, say, co-payments, okay, and fund the health sector adequately?
Mr. Odwe, now that there's been a pronouncement on how much will be allotted to the health sector, what next for civil society?
Yeah, for me, the bottom line as we talk about improvement in health outcomes, the most important thing, like my brother Godba said, is planning. If you have talked of reducing the number of children dying and you're increasing deliveries, look for the money which is not enough in the health sector and put it there. Out of the 92 billion that is going to the presidential pledge, like my brother Godbash said, can we remove 50 billion out of that money and we put it for hepatitis B, which is not funded at all?
Not hepatitis B. Make sure you put the health workers first. You know what I mean?
Yeah.
I know where your bread is. That's all we had for you on this show. To our viewers, many thanks for your views and opinion. Have a good night.
Thank you, everyone. This business award is for everyone who has supported me. My contacts around the world, my clients, my loan manager, Mwan Wamanja Bulungi, my family, and my sister Anne, who made Skyping and emailing people abroad very easy for me. Thank you, my sister, for that Vodafone connection you bought me. Once again, thank you very much.
Power to deal makers like Chicomico, chasing dimes on Vodafone's global 4G network. Because when you have Vodafone's reliable network, true customer care, and stress-free solutions, you have the power to go further. Get your Vodafone connection today at a Vodafone shop near you.
Vodafone, power to you. There are only 2 days in a year where you can do nothing. Absolutely nothing. Those 2 days are yesterday and tomorrow, which means today is the only day you have to fully live in the moment. So get out of the past and stop chasing tomorrow because you're missing out on today's moment. Laugh out loud, dance wildly, dream big, and be you. Live for now. It's the only moment that matters.
Grab an ice-cold Pepsi now and refresh yourself with its great, irresistible, stimulating taste.
Pepsi. Live for now.
Spectrum on Radio 1 FM 90. Brought to you by Finance Trust Bank, putting women first, and Mama Laundry Powder. Wash cleaner than clean.
The views expressed on this show are not necessarily those of this radio station or its management.